Evening. This is the San Joaquin County Civil Service meeting, December 8th, 5:30. Start with the roll. We'll hang on for just. Good evening. This is a meeting of the San Joaquin County Civil Service Commission. It's December 8th, 2021, 5:30 p.m. Call this meeting.
Okay, roll call. Commissioner Lofstrom,
Here.
Commissioner Picconi,
Here.
Commissioner Gutierrez.
Here.
For the record, we'll show that Commissioner Wander is absent.
Thank you. We'll move on to approval of the minutes. Are there any corrections?
I will move that the minutes as presented.
I will second.
Been moved and seconded that we approve the meeting minutes. All those in favor say aye.
Aye.
Opposed, no. Minutes are approved. Moving on to reports of disciplinary action. Ms. Hopkins, if you want to run us through the schedule.
Thank you, Chair. For subsection 2 tonight, reports of disciplinary action. We have no reports of disciplinary action for the commission to consider tonight under any of our subsections: reduction in salary, dismissal, demotion, or suspension. For our commissioners tonight under communications, Kathy Harris, our Deputy Director of Human Resources, is here to provide some follow-up on our Civil Service Commission vacancy outreach.
Commissioners. Good evening, Commissioners. Wanted to follow up to let you know that we have been in contact with the Board of Supervisors office. We've reached out specifically to the current vacancy district under Chair Patty. Spoke with them. They are aware. We explained and reemphasized the importance of the commission and the work that you're doing in having the vacancy filled. I was reassured that it was going to take a refreshed priority look at filling that vacancy. Also took the liberty of reaching out to this upcoming vacancy district as well, just so that they could be prepared to probably evaluate and determine quickly to fill that vacancy should it be vacant. Also, the clerk of the board's office on a regular basis with the all of the commissions and board vacancies, they send out an outreach and press release regarding vacancies, and they're continuing to do that. Our office is going to be following up with them again directly to see what the application activity has been, and if we can assist and work alongside them in their outreach efforts. This is a commission that they typically do outreach for.
That's great. Thank you. I appreciate hearing that, and I'm hoping that in 2022 we get the full board and are able to fill our mission a little more consistently than we've been. Does anyone have any questions they want to ask Ms. Harris?
Thank you.
Thanks.
Thank you, Kathy. We do not have any old business for the commission to consider tonight. So moving on to new business, under subsection A, amendment of class specifications, there are none. And under subsection B, adoption of class specifications, we do have 2 class specifications for the commission to consider tonight. The first one is classification project number 21031 for San Joaquin General Hospital. This is to adopt the classification specification for medical laboratory technician. And Roman Plateau from our office is here to present this on behalf of Human Resources. And I want to confirm, Mr. Plateau, this is the one that we do have a correction that needs to be made. So Chair, when we go to make a motion, there will need to be a correction in the motion to the minimum requirements. And Mr. Plateau will go over that, but we are missing a word. We're missing the word public in one of the lines. So we'll correct that with the motion, please.
Thank you. Okay, let's see, okay. Good evening, Commissioners. My name is Roman Plateau. I'm a personnel analyst with the San Joaquin County Human Resources. I'd like to provide a brief overview of classification project 21-031. San Joaquin General Hospital requested that Human Resources develop a new class for its clinical laboratory. The main goal of increasing the laboratory testing capacity, as well as to provide a pathway for career advancement for staff. The study was conducted in accordance with standard classification practices. Human Resources worked with the clinical laboratory deputy director to conduct a job analysis and develop a class specification. This included researching the licensing and scope of work parameters set forth by the state of California and by collecting samples of other agencies' similar classification series. As stated in the classification report before you, one of the main drivers in establishing a new classification is a recent change in California state law, which augments the work scope of licensed medical laboratory technicians to include testing of a moderate complexity. This presents an opportunity for San Joaquin General Hospital to add a level of support between the existing levels of clinical lab scientist and laboratory assistant, thereby increasing testing capacity and operational efficiency. This also implements an approach through which staff can gain experience and training to aspire to a higher, more complex laboratory technical position, such as clinical laboratory scientist. This new class also allows for San Joaquin General Hospital to compete with other hospital laboratories for this applicant pool, as it is common for this level to be present in their respective organizations. One small amendment, as Brandy was just mentioning to the classification, the licensing body that's listed under the minimum requirements is the State of California Department of Public Health. The word public was left out by mistake and will be added in the final version of the class spec. The new classification was provided to the hospital CEO and the appropriate union, which in this case is SEIU Local 1021, and all were given an opportunity to provide feedback prior to placing this project on tonight's agenda. Hospital leadership supports the new classification and no concern was expressed by the union. Therefore, Human Resources is recommending that the Civil Service Commission approve the new classification of medical laboratory technician. This concludes my overview of this study. I'm happy to answer your questions at this time. And we do also have the clinical laboratory deputy director if you have any questions specific to the department or the classification.
Great, thank you very much.
You're welcome.
Does anyone have any questions?
But what is a waived testing? Performs waived testing? I didn't understand what that was.
Commissioner, I'm going to have to rely on our clinical laboratory deputy director to come up here. Ms. Mui, if you mind joining us. This is a technical question to which I don't have the expertise.
Oh, yeah, I just didn't understand what under supervision performs waived testing of moderate complexity.
Oh,
What is
waived,
waived testing?
wave testing, there in the clinical laboratory, there are different categories of testing. Wave testing is the most fundamental test that somebody does not need a license to perform the test, meaning a clinical lab scientist to perform the test. For example, like the glucometer that you're using is called a wave test. The COVID antigen test is a waved test, not the PCR test, but the antigen test is a wave test that a nurse can perform, not a clinical, or some pharmacists can perform. So those are the wave tests. And the next category is the moderate complexity test, which is like a chemistry test, some hematology test. And again, the highest category is the high complexity test, is microbiology, reading the slide under the microscope. Those are the high complexity test. So this medical laboratory technician position does allow a person to perform wave tests as well as moderate complexity tests per the California Department of Public Health, but definitely not the high complexity test. So it acts as a breach.
So does the person that's being tested, they have to waive that this person can test them instead? Is that what that is?
No. It's just about the test category that is called waived, moderate complexity, and high complexity. And this person needs a license in order to perform those tests.
Okay, yeah. Thank you.
I had the same question. I looked it up and you'll find it very easily. If you look it up, you'll find the explanation. in
I should have,
addition.
I should have done that. Is that what you're saying? I should have done it the easy way.
Any other questions or comments?
The other thing is, do they do injections?
No, we are not allowed to do injection, but they can draw blood.
They can draw blood. Thank you.
That's it?
Yeah, that's all I have.
Thank you.
Okay, thank you. I'll entertain a motion to approve the classification project 21-031 with the addition of the word public for public health.
So moved.
Yeah, I'll second the motion.
All those in favor say aye.
Aye.
And there's no opposed. Great, passed.
Thank you. Our second classification study tonight, classification project 21-034. This is the Healthcare Services Agency, Office of the Medical Examiner, and Amy Brimmer, our classification manager, is presenting to the commission tonight.
Good evening, Chair Lofstrom and Commissioners. This item requests that you adopt a new classification for supervising medical examiner investigator and approve the changes to the existing medical examiner investigator and trainee. The Office of the Medical Examiner, or OME, requested a working first-line supervisory classification to oversee investigation staff. This request was driven by audit findings that included staffing recommendations to fulfill the need of a highly sensitive and technical 24/7 operation. So eventually, Commissioner Piccone, we will get there, baby steps at this point. So this class will oversee as well as perform investigations to determine cause, manner, and circumstances of death, while also performing administrative duties related to the work and the operations of the unit. Incumbents will be able to effectively plan, organize, direct, train, and evaluate work of assigned staff. For the trainee level, changes are limited to just adding our standard disability accommodation language. And then at the Journey Medical Examiner Investigator level, we are proposing to adjust the minimum qualifications. We've learned that through multiple iterations of the recruitment process, it's been very difficult to distinguish candidate qualifications between this journey level and the trainee level as they were currently written. And so we're proposing to change this type of experience required at the journey level to provide for only those who have the applied experience in investigative work regarding death of persons, not just the handling and exposure of them, as the trainee level will provide. But the previous qualifications allowed just didn't have that the component enough to separate out the two. And so hopefully this will do that for us. Otherwise, you may see us again to refine and ensure that we can distinguish between the very entry level and the more entry level and the journey level candidate. This is the summary of the classification item. The affected union, which is SEIU, was notified on November 23rd, and no objection was made. The operations administrator for the medical examiner's office, Paul Graves, is available and participating remotely. Should you have questions of the department?
Thank you. Does anyone have any questions they wish to ask?
Yeah, I just wanted to understand about the substitution required. The first, you're looking for a bachelor's degree from an accredited college in those certain areas. And then you can substitute, or you could substitute additional qualifying experience in medical nursing or investigative field and so forth on a year-for-year basis. And so instead of the BA, they can do, what is that? Would that be 4 years of experience doing that, or is that?
Commissioner Gutierrez, can we clarify for the record, you're talking about the supervisory Which job
Well,
specification?
The first one.
Okay.
Then I think it's says that in some of the others too.
Okay,
They all have that the substitution of experience for, I guess, instead of the education of the degree,
Mhm.
then there's so many years of experience that you could substitute with a certain kind of experience that qualifies.
That is correct.
Is that correct?
Exactly. Mhm.
So does that mean then that with 4 years of a bachelor's, takes about 4 years? Is that the way you're looking at it? Is that how we look at it?
Correct.
Okay. All right.
Well, with a bachelor's degree, we do a value of either equivalent semester or quarter units. And that's standard across the county organization. And then a year of service would be equivalent to a full-time year of service.
All right, let's looking at the minimum qualifications for the medical examiner investigator trainee.
Okay?
Yes, that's page 2 of that. Are you on there?
Yes.
So a substitution experience, would that be then 4 years of experience doing those qualifying areas instead of a degree? Is that what we'd look at?
It would be up to that amount, correct? Or a combination.
I think that's good. I just wanted to understand if that was,
Mr. Graves could probably expound on this a little more, but this industry can be learned very much either through formal training, but then also most definitely in a capacity of on-the-job training. So the formal education would help someone who is probably more at the very entry level, the trainee, or a combination thereof of applied experience and the education, and then on-the-job training could very easily work into it. There isn't necessarily a formal education discipline that ties immediately into this type of work per se, but it is a way to offer someone to come into the work with a type of combination of education and or experience
yeah, I think
that
that's
would
good.
lend itself
Yeah.
to.
Okay.
Yeah.
That's all I have.
Sounds like there are no more questions or discussion, so I'll entertain a motion to approve classification project number 21-034 as written.
I'll make the motion, yes, to approve.
I'll second.
All those in favor say aye.
Aye.
And the motion pass.
thank you. Thank you, Amy.
Thank you,
Under
Amy. Thank you,
subsection C.
Commission. Thank you very much.
Oh, thank you, Paul. We do not have any classification studies for the commission to consider tonight. And under subsection D, there are no staff reports. Subsection C, request for appeal hearings. We do not have any request for appeal hearings under Rule 3 classification, Rule 18 dismissal, suspension, demotion, or reduction of pay, or Rule 19 violation of rules. There are no other requests for the commission tonight. And under subsection 6, we do not have any dates to set for appeal hearings. That moves us on to public comment. I'll go, Ms. Strange, do we have any public comment before I read the spiel?
There's no public comment.
Thank you. Are there any members of the public who wish to speak, give public comment? Okay. Thank you. Brings us to our future meeting dates, and our next Civil Service Commission meeting is set for our first 2022. It'll be January 12th of 2022 here in the Administration Building located at 44 North San Joaquin Street, room 146. You'll see the remainder of the commission dates are followed. I do know we have some dates that the commissioners have conflicts on. Donna and I have noted those. Lastly, for tonight, we do not have any appeal hearings or closed session. Unless there are any other commission business, Chair, you may adjourn the meeting.
Thank you. The meeting is adjourned. See you in 2022.
Thank you. Have a happy holiday.